Great. So it's just 2 o'clock on the dot. So I think we'll make a start. I know some people will be joining us in a few minutes or so. Good afternoon, everybody, and also good morning and good evening for those of you that are participating from different time zones. Welcome to today's webinar on alcohol prevention and cancer control, which we have organized to mark the Awareness Week on alcohol-related harm. And this webinar is part of a series actually that we started back in 2018, where we try and focus on the different messages within the European Code Against Cancer to raise awareness of this very important tool, which is dear to ECL and also to cancer leagues across Europe. My name is Ginevra and I am the Communication Officer at ECL, the Association of European Cancer Leagues, and I will be your host and moderator this afternoon. Next slide, please. Great. So today's webinar is actually co-hosted and we're really excited that we have here with us the International Agency for Research on Cancer and the WHO Regional Office for Europe. And I'm utterly delighted to be having here with us today Dr. Nana Karabisoglu. She's a nutrition and cancer epidemiologist and as well as a postdoctoral researcher. And she's actually part of our ECL Youth Ambassadors for the European Code Against Cancer program. Then next we have Dr. Isabelle Soerjomataram, who is a medical epidemiologist at the International Agency for Research on Cancer. And then last but not least, we have Maria Neufeld, a consultant at the WHO Regional Office for Europe. And today with me, actually, I also have my colleagues, Anna Szabo, Communications Assistant, and David Ricci, who's the Cancer Prevention Manager here at ECL. And I hope you are well prepared and excited to join us this afternoon to learn more about the code as a tool for cancer prevention, the link between alcohol consumption and cancer, as well as some of the policies and interventions to reduce this alcohol attributable burden in the EU region. In terms of agenda, I will quickly go through some housekeeping items in a second. Then we have Dr. Karabisoglu, who will give you a brief overview of the European Code Against Cancer and also say a few words about her involvement in the ECL Youth Ambassador for the European Code Against Cancer program. Then we have Dr. Soerjomataram, who will do the first keynote presentation. She will present for about 50 minutes, and then we'll take a first round of questions from the audience. Then we have Mrs. Neufeld, who also present for 50 minutes or so, and then we'll take a second round of questions. And then we would like to conclude the webinar with a short quiz to kind of test your memory and knowledge of what we presented to you today. And then we will have some concluding remarks from my colleague David. So next slide, please. I'll just go quickly through a few housekeeping items. I know we're all very much familiar with how Zoom works, but we would like to, if you would like to ask any questions to our keynote speakers, we would kindly ask you to type them into the Q&A function. We will, of course, strive to answer as many as we can within the time limits, but we won't be able to answer all of them live. This is a view-only webinar. So we won't actually make use of the raise hand function that you see on your toolbar today. So please refrain from clicking on that button today. Also, after the webinar is over, you will be directed to a very short survey, and we do really value your feedback. We've been doing this series for quite some time now, and we always strive to make each of our next webinars better. So please take a minute to answer 4 quick questions about today's webinar. And then finally, of course, this has been recorded, and you will receive a thank you email in the coming weeks with the slides, the recording of today's webinar. And yes, next slide. Without further ado, I'll hand over to Dr. Karabisoglu. As I mentioned, she's a nutrition and cancer epidemiologist and also a registered dietitian. And she currently works as a postdoctoral researcher. And we're very proud that she's been youth ambassadors for the European Code Against Cancer with us for both Switzerland and Greece since 2019. So Nana, you can take it away. Thank you.
Thank you, Gina, for this wonderful introduction and for giving me a chance to present the European Code Against Cancer and the work we do in the Youth Ambassadors program. So for those of you who are not familiar with the European Code Against Cancer, it's an initiative of the European Commission developed by the World Health Organization's International Agency for Research on Cancer, in short IARC. Its goal is to inform people about actions they can take for themselves or their families and loved ones to reduce their cancer risk. The European Code Against Cancer is based on the latest scientific evidence compiled and assessed by leading scientists. And as you can see on the screen, it has 12 recommendations that anybody can follow without any special skills necessary. As you can see here, the 12 recommendations range from a number of things like smoking, body weight, diet, physical activity, vaccinations, and screening. But today, we are going to focus on message 6. So Anna, please, the next slide. And message 6 is all about alcohol. The European Code Against Cancer is clear. If you drink alcohol of any type, you are advised to limit your intake. And in terms of cancer prevention, it is actually better if you are not drinking alcohol at all. So before I hand over to the speakers, I would like to briefly present to you the Youth Ambassadors program and the work we do. So next slide, please. So what is the Youth Ambassadors program for the European Code Against Cancer? It's an initiative of ECL to draw on the enthusiasm of young health advocates to promote the European Code Against Cancer. Why? Because we help disseminate the European Code Against Cancer messages within Europe through active, motivated local people. And who are we? We are just youths with links to network, associations, societies who can disseminate the code locally and provide input to global promotion. Next slide. So we are very proud that at the moment we are 69 youth ambassadors from 39 countries of the WHO European region. Next slide. So what we usually do, we take part in joint actions like international campaigns, for example, for the World Cancer Day or the European Week Against Cancer. We create and disseminate informative materials. We participate in school competition and organize our own virtual art exhibitions. We take part in advocacy initiatives and research projects. And apart from these joint actions, we also have individual actions like presentations, workshops, seminars, and trainings about the European Code Against Cancer in universities, associations, or conferences, awareness raising and dissemination of promotional materials in events and on social media, while we also take part in research projects and other activities like marathons, hackathons, or cancer screenings. Next slide. So I would like to briefly present to you my experience with promoting the European Code Against Cancer. I have been a member of the Digital Communications Working Group since its creation in 2020, where we try to streamline the social media presence of the European Code Against Cancer. Apart from that, we promote events by other youth ambassadors, but we also organize our own. And here I present two examples. On the right, the live session ahead of the World Cancer Day 2021, where I presented the European Code Against Cancer messages on nutrition, and my colleague Carmen, the one on physical activity. But also on the left, our holiday meal competition for last year, where we encouraged people to submit recipes that were following the European Code Against Cancer's messages on diet and alcohol, and win a prize. Apart from that, next slide, I am also helping maintain the Greek Youth Ambassador accounts, where I translate and help disseminate important cancer prevention messages in my mother tongue. So if any Greek-speaking people are in the audience, I encourage you to check them out. And with that, I am finishing with my presentation. So back to you, Gina.
Great, excellent. Thank you so much, Nena. We really do value the work of our youth ambassadors, and they've really been instrumental in kind of disseminating these messages at the local and regional level, especially in their languages. So whilst Dr. Soerjomataram will start sharing her screen with her presentation, I just want to take a second to actually introduce her a little bit better. She's a medical epidemiologist and also the deputy branch head for cancer surveillance at the International Agency for Research on Cancer. Dr. Soerjomataram holds a medical degree as well as a PhD in cancer epidemiology, and she actually specializes in descriptive cancer epidemiology and also health impact assessment. And her research interest spans international variation in the cancer burden, the impact of prevention on cancer, as well as new cancer indicators and the impact of cancer and healthy aging. So without further ado, I'll just let our first keynote speakers take it away.
Thank you so much, Gina, and thank you so much for the team, Anna and also David, who have been inviting me, but also then supporting all of us speakers here in a lot of the practicalities. But I would also like to thank you everybody who are then present today in this special event. I know that there's a lot of webinars happening at different moments, that people are here then choosing to come to this special one. I would like to thank you all. And then I saw that there's a lot of participants from all over Europe, which make this then even more exciting. So hope that we'll have then a good discussion afterwards. Today I'm going to present a little bit about alcohol drinking, about the pattern globally, but then also then taking a much closer look into Europe, because then today we are kind of trying to focus in Europe. After that, I'm going to link that then to the burden of cancer in Europe. Show just one study that we've been doing on trying to look into then the impact of doing an intervention, only one intervention, and how that would impact then cancer in Europe. Maria Neufeld and from WHO will then pick that up longer. But today especially as well, I'm going to take a bit of a stronger focus on women and cancer, especially, and women and alcohol drinking. So I'll end with that part later on. And then I hope really then to hear what everybody's here think about that last part especially. So a lot of this work has been done by Harriet Ramgay, a really talented PhD candidate in the group. And then I would like to thank her then for a lot of the work that she's done. So just to give a little bit of a background, alcohol has been recognized as a cause of cancer officially. So this is done then by an expert group, which is then done in a group which is called the Monograph still today, 30 years ago. So it's been a long time that cancer is recognized as that alcohol is recognized as a cause of cancer. And even before that, there were then, of course, a lot of studies already pointing to the fact that alcohol causes cancer. So in this then report, drinking alcohol is reported then to cause at least seven types of cancer, depending on then how you cut or divide then cancer types. But then if you look into then a few other cancer sites, there are also other cancer sites which is then not mentioned here. For example, cancer of the stomach and cancer of the pancreas, which are also then related to alcohol, but then they are related to drinking alcohol when one drink then at a higher level than usual. So this is a bit of an underestimation of the total portion of cancers that are related to alcohol. If we want to be much more expensive, then we can increase the number quite easily. And then those cancers that I mentioned just now have quite a poor prognosis. So they are not at the moment included, but then so it's really then important that 7 cancer is almost an underestimation than what we are going to present later on. So going a little bit on alcohol and cancer in Europe. So this is then the global map of alcohol drinking globally. So this is the proportion of people who drank alcohol in different countries. This is then men and women combined, so both sexes combined. And then if you can see the color when then it's more red or darker red, like what you see then in Europe, for example, in European countries, those are then where then the proportion of the population who are then current drinker are largest. So just picking up then several of the Northern European countries, let's choose here the UK, for example, Republic of Ireland, but also Norway and Finland, you see then really high proportion of alcohol drinkers. So over 80% of the population there are alcohol drinker. And then you see that as well then with Central Europe, for example, then noted here, and then also Western European countries, just picking up then one country here, for example, Germany. And then you see a very different picture if you then go to other parts of the world. Thinking of Northern Africa, I saw then someone from Turkey giving a message here, leaving a message here. In some parts of the world, alcohol consumptions are very, very low. Of course, that has to do a lot with culture and religion, but then without even that, there's other parts of the world where then drinking alcohol is then much less. Also then suggesting that it is possible to reduce alcohol drinking. It is not as impossible as one might think. So going then further into Europe, and then now really then getting into the number itself. So just in Europe alone, almost 200,000 cases are caused by alcohol. So this is then 180,000 cases to be precise in 2020. The cancers that are most related to alcohol, that contribute then most to the cancer caused by alcohol are colorectal. So those are cancer of the bowel system. After that then comes breast cancer, and then a lot of cancer in the head and neck, so the oral cavity. Liver, this is then well known. Esophagus is then the tract that link oral cavity then to the stomach, and some other cancers then are in there. And then if you see then to the right-hand side of the picture, you see then the picture in terms of number, in terms of cancer cases, cancer rates in different countries in Europe, and then how they are linked to alcohol. And then you see a big difference between men and women. In some countries, men and women both drink as much, or then there's as much as cancer linked to alcohol in both sexes. Like, for example, you can see here then in France, where that's quite obvious. Well, then in some other countries, you see then a quite different picture between men and women. So the point that I want to make here, of course, and we're thinking of prevention in general and trying to target different a whole group in total at the same time, but perhaps when we're thinking of the prevention method itself, thinking now that there's a lot of youth ambassadors here, maybe then there's different types or way or approaches that we can get into then the different subgroups of the populations. So then our prevention approaches then work much better. If we're looking into then the total cases in Europe, 2/3, 66% among all these cases are actually in men. And then, yeah, as I can say, as I showed here, then you see a very different pattern between men and women. So going now into the details, and then I find this very interesting because then it also, I think at the end, have an implication in terms of what kind of prevention we want to do in different subgroup of the population. So in the analysis, what we've done, we categorize alcohol drinking into 3 groups. So those then who drink heavily, and those then who drink moderately, and those then who are then light drinker. Calling them light drinker probably is not very good, but then those then who are drinking in the smallest proportion of the whole group. If you're thinking as general the pattern, looking into then the cancer cases in Europe that are then related to alcohol, so half of them are related to heavy drinker. Well, then some proportion are related to moderate drinker, but there are still then proportion that are related to what a lot of people think as light drinking, but still it is an important number of cases. And often people hear, because thinking of the health messages that have been around, drinking alcohol a little bit doesn't cause cancer, but that's really then a myth. It's not true. Drinking alcohol at any level causes cancer. And then on the right-hand side, then you start then to see that what I find really nice differences again between men and women. Well, then in men, in all then the countries, you see the proportion of the cancer that are related to heavy drinker are really important. Well, then in women, if we see then proportionally, cancer cases in women are more often as compared to men are related to what again we call light drinking. So then again, this is a message that for men and women, probably we need then to think also of different approaches on how we can then prevent or reduce alcohol drinking. And then if you see then the countries in terms of where then cancer then are caused more. So for example, if we are taking then some countries a lot in the WHO what it's called then NIS country, so the independent states, 8%, so that proportion is really big. 8%, or that's almost 10% of cancer are related to alcohol drinking. So reducing alcohol drinking can reduce a lot of the cancer burden in such countries. And then the number here that you saw, that you can see, is then really highly related again to the previous map that I showed, where then countries, for example, in Western Europe are also then some of the highest there, well then going down in some of the other countries like Sweden that have been made into a lot of the examples of best practices in Europe. What we did as well then afterwards, but then I'll let then Maria to show then much more of this work. We also then calculated or tried to calculate the impact if, for example, governments were then to increase the taxes on alcohol. Again, taxes on alcohol is only a part of the price. And then if we were then to increase this tax, how much of the cancer cases can we prevent in Europe in year 2018. So this is then for the cases in 2018. And then we did then several scenarios, so increasing it by 20%, increasing it by 50%, and doubling then the excess tax. We take, of course, then the information how much tax already are there in different countries and then adjust for that. And then this is then what you see. For example, then you see on the top the number of new cancer cases that can be prevented in different countries in WHO Euro region, and then in the lower part then is then what you can see in terms of death. So then you see then a lot of countries that came up in the previous picture. So for example, taking here then an example of Russia, but also then UK, France, Germany, also Italy are then some of the countries that can benefit then from increasing this tax. But then you can see that benefit in all other countries as well. And this is just taking one step to reduce alcohol consumption, and you can have such an impact already. So going then a little bit into men and women, the differences in the two, as I mentioned before, in terms of drinking pattern, but then also impact on cancer burden. There's a difference between men and women. And then today I would like then to focus in women. If we see then in several countries, especially then in Western European countries, but this is true as well, for example, in the US or in Canada, the total then ring or donut that you can see here are then all cancer cases that are related to alcohol drinking. And then if you see the number one cancer that are caused by alcohol is breast cancer. So this is then the data from France. And this fact is really rarely known by a lot of people, men and women combined. People don't know that alcohol drinking can cause breast cancer. And then if you try to estimate how much the burden of cancer that are related to alcohol, breast cancer comes in as the top, for example, then in France. So 1 out of all cancers related to 1 out of 4 of all cancer related to alcohol is breast cancer, and this is information is really not well known in the population. This is then another example from the UK, and then you see a very similar picture, but even then even stronger. In France it's 1 in 5, and then in the UK it's 1 in 4. So breast cancer is one of the cancers that are linked to alcohol drinking. And then I mentioned this before, in men and then in women. If we are looking then into then the different types of alcohol drinking, so here then we heavy drinking, if then you drink more than 60 grams of alcohol per day, risky drinking if you're drinking 20 to 60, and moderate drinking if you're drinking less than that. So you can then see how much of alcohol drinking that is more and less would mean. And then you see then men and women have a different pattern, like I mentioned before. Men, a lot of the alcohol that are caused by a lot of the cancer that are caused by alcohol in men are linked to heavy drinking, and some of them to risky drinking. But if we see in women, it is much more than related to the moderate and risky drinking, so it's very different picture than in men. And then I want to come back, a lot of you don't know this, but I lived a little bit in this time period where then a lot of companies target women specifically for certain product. This is then actually then a product for alcohol. So around the 70s, companies are targeting women, especially then to pick up smoking. And then while we are seeing then in some countries that this is then starting to be not allowed, because then there's a lot of regulation, these companies are taking then these messages to other parts of the world. So then this is then a picture from the very same company, tobacco company, that targeting women then in different parts of the world. This is then a much more recent pictures, for example, than from women in Africa. And that is true as well when we are today talking about alcohol. And then today, it's not only women, but they're also looking especially into young women. And then we see, based on articles, so as women's socioeconomic status increases, there's a certain empowerment, but then there's also then the increasing drinking habit then among this specific group that companies are taking an advantage of. That's at least in my opinion. And then this should be then really known, or at least we should be aware of this. So then something can also be done about it. Taking then this as a final comment, I think what we know now, we have much more detailed data on the types, on the how the distribution of the burden, but then how then the drinking habit itself are then in the population. It really then highlights that we need effective policies, and then it should be implemented, but in the ground it is real the approaches that targeted then specific populations are also needed. So then when I heard about this whole youth ambassador, I think that is one way then to do this. And then of course then I congratulate all of you, and then wishing you all the best in the future. Many thanks. Thank you. And then yes, anyone who are interested with the data and want to play more, want to know then your countries, your age group, population, etc., those data and information are available then in the Global Cancer Observatory, especially then on the cancer causes on alcohol. Thank you.
Excellent. Thank you so much, Dr. Soerjomataram, for being here with us today and for kind of setting the scene and the brief overview between the link between alcohol consumption and cancer risk. And I think what I took away from your presentation was really highlighting that statistics and figures on the cancer burden do really have practical implications for prevention and for tailoring intervention to different subgroups. I also learned something new myself personally, that cancer cases in women are more often related to light and moderate drinking, which I think is very interesting fact. Especially for our youth ambassadors that do these peer-to-peer communications to their peers. And also, of course, I think we have a bit more work to do as youth ambassadors, as cancer leagues and civil society to really raise awareness of the link between breast cancer and alcohol, which seems to be pretty low. So I hope also our viewers have learned something new today. And I think now we can open the floor for questions from the audience for about 5 minutes. And I know also maybe our youth ambassador Nana had some questions, and then I will let my colleague David moderate the Q&A discussion. Thank you.
Can I start with my question?
Indeed.
Perfect. So in recent years, we've seen an increase in lung cancer incidence in women, and it is thought to be attributable to women taking up smoking decades later than men. Do you expect to see a similar increase in alcohol-related cancer for women in the upcoming decades?
Actually, if we're looking into, so that's true. Smoking among women are increasing. It start to stabilize in some countries, but it's really actually a pity that then it's increasing so much. In some countries, actually cancer related to tobacco smoking in men, it was really high before it's going down. Well, women are now catching up with those cancer among men. So, but then if you're looking into alcohol, actually in terms of the trend, what we're seeing overall, alcohol drinking have been decreasing because in the past alcohol drinking is just so much more, and then these decreases what we're seeing are quite similar in men and women. Of course, this is different in country to country. We're still seeing then a lot of more alcohol drinking, again, different from country to country among the older age group, because that is then a bit of a habit that is taken from the past. But there's what is then a bit worrisome, especially if we're talking about women and younger people, is then the amount of alcohol. We measure alcohol drinking in different ways. Some of the things that is quite worrisome is then the number of times of people who are drunk in, for example, a month or in a week. In the younger population, that is going up. So of course, cancer is has an important link to alcohol, but it should be also noted that alcohol is not only linked to cancer. It has much wider implication than cancer alone. So those worrisome patterns need to be taken into account. We are seeing good progress, but we need then to do a bit more. And then we can, especially in Europe, where then the level of drinking is so high.
Thank you. And that leads me very nicely to my second question that has to do with taxation. So you propose taxation as a way that we could employ to reduce alcohol consumption. So based on our collective knowledge from similar taxing schemes, for example, in sugar-containing beverages, do you think that a potential alcohol taxation could be successful? And basically, what have we known from other taxing schemes that we can avoid to make it successful?
The best example, Maria could discuss this more. There's a lot of good examples in terms of taxes in Europe that have been really, really successful. But yeah, I'll leave Maria to that. But then one of the best example of taxation is tobacco, of course. The decreases of tobacco consumption or smoking, a lot of it are linked to increasing price, and then one way to increase its price is by increasing taxes, because that come back again to the government, of course. So tobacco has been so successful, and then it's been now then also taken a bit more recently for alcohol, but it should and then we are also trying to take that example, for example, in sugar. I'm not saying that it should be or maybe useful for everything, but increasing, there's quite a relation between increasing prices and then consumption, yes. So yeah, that's one. But then Maria, maybe you can tell a bit, a few examples.
Maybe we can come back to it a bit later, because we have a couple of questions from the audience that David will report. So thanks, Nana, for that. Maybe we can take some from the floor.
Okay, thanks. We have a couple of minutes, so there's quite a lot of questions. I hope I can get through some of them, but if not, we'll send it in a report, email afterwards. So the first question is quite interesting one. When you look at the WCRF's reports, they have the table and it shows you also on strong or not so strong evidence, and then convincing, probable, and so on, regarding increase, but also reduction of cancer risk. And there is, when you look at the table, a probable decrease of risk of kidney cancer. So one could say, in a kind of provocative way maybe, shouldn't we not say, from the point of view of minimizing alcohol-related risk of cancer, that not drinking at all is somewhat not telling the full picture, not slightly misleading? How would you react to that, Isabelle?
I thought you were going to answer that.
Oh.
Okay.
I can answer after you. I can answer too.
Well, so yeah, in a lot of the measurement of hazards or risk of getting a disease, different institutions use different levels of evidence that exist and to point to that risk. For example, like what David is mentioning, from high to low, and then they, depending on the evidence, they would say then there's strong evidence. The evidences from different sciences are then leading to this. But I will then give this to Maria again, because I think there's a very different approaches if we want to talk about population communication and then scientific communications. Yeah. And then we all need to be aware of it. And sometimes not to be simplistic, but in terms of giving population messages, I think simplistic is often better. The other part, what I think it should be done as well, is consistency. And then having different messages from different institutions are really bad in terms of population communications. But these are simplistic, yes, but it's also important to stay simplistic rather than convoluting a lot of the information. It makes the messages unclear, and then it wouldn't then get through the population. Of course, transparency into the evidence has to be there as well.
Yeah, I completely agree. I think it's published, it's available like this, and it's interesting from a scientific point of view and for a certain audience. And the message, I think, in the code is quite well crafted, from the point of view overall, the balance when you look at the risks, the different cancer sites, both genders and so on. When you balance it up, overall, it's better from a point of view of reducing your cancer risk, cancer prevention, to limit and ideally not drink alcohol. Of course, this has to be, as we'll get into the further discussion when we have Maria's presentation, this is something that then needs to be crafted into both an understandable, comprehensible message to the public, respecting where we are, and what we can do with the tools available. But yeah, I think we should, of course, as we are in this group, with transparent with the evidence, and it's always important if you're advocating these messages to be aware of the full picture. And you could also say, there is evidence that smoking reduces severity of colitis, ulcerative colitis in certain populations, but you wouldn't then go around advocating smoking on the basis of that small and highly conditional piece of scientific conjecture. So next question would then be about the range of risky drinking, which is how is this range established? Basically, I could also say about high risky drinking, but also for the moderate range, what's the values?
It's
and
a simplistic. This is a simplistic, almost arbitrary grouping. We can form the groups in a lot of different ways, and then we had a lot of different discussions within the authorships, what kind of group we should put, and then it was then, but then the data of course is available if you want to have them at a lower rate, and then the informations are available as well. If you would like to look into that data further or write something on it, we would be happy to share it with you.
Excellent. And then last question, how do we explain that alcohol consumption has greater impact on breast cancer than liver cancer in females?
So a lot of that has to do then with the background population cancer risks. Liver cancer is a much less common cancer in some population in Europe. For example, let's say that example is then coming from France or from the UK, because the number of liver cancer to start with is already small. So the proportion of liver cancer that are related to alcohol could be higher than breast cancer. But at the end, if you pull those numbers together, breast cancer would then have a bigger contribution than to the whole cancer causes. So you can present the data in different ways, either then in proportion out of the specific cancer, and then liver cancer would be higher, or then presenting it as a total, showing what types of cancer are caused by alcohol, and that would be then really linked to the background population, how cancer distribution in that country look like. So breast cancer is a very common cancer in France, and therefore the numbers, in terms of numbers, then there's much more than that are related then to alcohol drinking.
Excellent. Great. Thank you, Isabelle. So hand over to you, Gina.
Yeah, thanks a lot, David, for moderating the discussion. I know we have quite a few questions we haven't gone through. So if Dr. Soerjomataram can kindly reply in writing of any of that during the meeting, otherwise we'll go back to the viewers later on. But now let's move on. And whilst Mrs. Neufeld shares the screen, I just want to take a second also to introduce her a bit better to you. Mrs. Neufeld works as a consultant for the Alcohol, Illicit Drugs and Prison Health Program in the WHO Regional Office for Prevention and Control of NCDs, which is actually based in Moscow. And Maria is a researcher in the field of social and behavioral epidemiology of substance use and policy response. And she actually has a special focus on countries in the eastern part of the WHO European region. So she's been involved in various projects on alcohol consumption, the alcohol-attributable burden of diseases, and also the evaluation of alcohol control policies, especially pricing and alcohol taxation and labeling, which we are very happy to have her today to hear more about these interventions and what's been successful that's been proven. So Mrs. Neufeld, the floor is yours. Thank you.
Thank you very much. I just want to make sure that everyone sees my presentation as intended.
It's perfect. Thank you.
Great. Thank you so much. Well, I've seen that there's already a debate on taxation going on, which I think is very interesting, and I'm happy to dive more into that. But first of all, thank you so much for having me. Also a big thank you to Isabelle and her team. It has been such a great collaboration so far, and I'm looking forward to what more will be achieved together. So Isabelle has already started to mention that, and just to give a bit of a context also globally in terms of harms. So you all probably know that alcohol is causing 3 million deaths each year globally, and out of those 3 millions, 1 million occurs in our region, the WHO European region. And if we look at the distribution of those deaths here on the left-hand side, you will see those in red, those are the alcohol-attributable fractions. So basically the proportion of all those deaths from that condition that are caused by alcohol, that are attributable to alcohol. And of course, something like an alcohol use disorder, by its very own definition, will 100% cause alcohol. But then if you look at the other conditions, you will realize that a lot of those most common, most frequent diseases, that they have quite a large proportion of that alcohol-attributable fraction. So, and those are the very common diseases like cardiovascular diseases and also cancers. And this is, of course, something that a lot of people do not understand, that whenever we're talking about mortality from alcohol, we're not just talking about alcoholism. We're really talking about those very common, very frequent diseases, and of course, including cancer. And right now, for instance, in the European Union, cancer has become the leading cause of death. So this is why it's really important to understand that context and to really see what is it that we're actually talking about, and not shift the responsibility, you know, like to the alcoholics, to the one with an alcohol use disorder, because this is, again, as Isabelle was saying, this affects a lot of diseases and a lot of people. And well, you have a lot of you have already seen those presentations, and also Isabelle has presented it very nicely. Whenever we talk about alcohol and cancer, there are at least 7 different types of cancers that are caused by alcohol consumption. And as already was pointed out, we have for over 30 years, so 3 decades of not even evidence, but like the classification that it has been identified as a cause of cancer over 30 years ago. And if you look closer at documents, you will realize that it's classified as a group 1 carcinogen, meaning that it is in the same group like asbestos, radiation, tobacco, like all those things where, you know, like everyone knows, yes, of course, tobacco, it causes cancer, radiation, it causes cancer, this is bad, and I don't want to be exposed to that. But for alcohol, for some reason, the awareness of that fact is not there. It's not yet there in the general population, but also in the health professionals, because as was already mentioned, there is that myth, and some health professionals, they even prescribe alcohol, like a glass of wine or something, to their patients to relax, or to, you know, like there's the belief that it's good for their heart and so forth. But as David was already saying, you know, like you would not prescribe something like smoking for, I don't know, weight loss, or, you know, like other things that people might struggle with. So, and if we stick to that comparison with tobacco, again, with something that everyone understands, oh yeah, if I consume that, I expose myself and I can get cancer. If we compare the policy response to that risk factor, we will see that, well, the policy response and awareness is much weaker in like those really important areas like taxation, which was already discussed here, but also labeling and availability and marketing. And this is because of that, but also a consequence of that. So of course, this is something where I think we need to translate the evidence that Isabelle was just presenting into policy action. So, and in relation to taxation, now I regret that I didn't bring that slide with me, but just to say that, for instance, for tobacco, the current proportion of taxation in the final price of the most common cigarettes brands for the region, for Europe, it's about 70%. And for alcohol, we're not even at 20%. So this is sort of the reference frame if you want. So I will not talk too much about that. I think Isabelle has really covered it really well. But here just another picture on the proportion of breast cancer. Breast cancer is the most frequent type of cancer in women, from what I know. And here we see again like this, that the majority of breast cancer cases are not caused by heavy drinking. And I know that there has been a lot of discussion around like those classifications, like the thresholds and so forth. And I just, I just want to echo something that Isabelle was already saying. In a way, like those thresholds, they are They're very operational, that they give us, you know, like some guidance so that we can dissect the data a bit better and to also target the prevention. But it's very important to understand that the risk that it starts from the first drink consumed, and that it only increases later on. And because this new evidence has been coming and has been indicating that the risks are really increasing from the first drink, in a way, at least we as WHO Europe, we do not define those risk levels anymore, because for those conditions like cancer, they might not make as much sense as they do, for instance, for, let's say, injuries, because like for drink driving, you all know these risk curves, where we know very clearly that the risk of getting into a car accident and also dying as a result of it, that it really increases exponentially the more intoxicated the person is, or it has really strong consequences like for drownings and falls and so forth. But with all those new studies coming out, it's really important to emphasize that for cancer, the risk that it starts with the first drink, but not just with cancer, and bear with me for a moment. But then a lot of colleagues and a lot of people ask me, like, yeah, but what is harmful use of alcohol then? What does the WHO mean with that? And I just want to explain this a bit, because again, it's quite a hot topic of discussion also, I think, right now. And I just want to clarify that this is a concept that has been introduced in 2010, when the World Health Assembly has adopted the global strategy to reduce the harmful use of alcohol, which was the first global document endorsed by all member states to lay out a strategy. So the concept of harmful use of alcohol, it was introduced there to sort of define the scope and the target of those public health measures. And it's a very broad term. So it's, I will not read it out, but it's basically drinking that causes detrimental health and social consequences to the drinker, the people around the drinker, and whole societies. And then there is even a second definition of harmful use, which is actually a clinical term, which is a clinical diagnosis in the ICD-10. And so yeah, so those terms are different, because the first one, it's broader. But again, this is a global strategy that was adopted in 2010. And since then, a lot of things happened in terms of evidence, and the evidence has been evolving. And I want just to briefly point out a study, a very important key study that came out in 2018. And is based on that study, we issued immediately a statement saying, like, well, this study shows that there is no safe level of alcohol use. And this is the GBD study from 2018. And here on the left-hand side, you see again that risk curve. And this is not just for cancer. This is for all outcomes, including, I don't know, cirrhosis, injuries, and so forth. And here you see that the risk is increasing from the first drink. I mean, it doesn't increase as steep as, for instance, for cigarettes, where you have like very steep increase starting from the first cigarette, but still it increases. And then, like, okay, the confidence interval widens, but we see that there is this dose response relationship. And here again on the right hand side, you see that for women, for breast cancer, and you see that also for men. Here an example of lip and oral cavity cancer, so the head and neck cancers that Isabelle was already talking about. And here, just look at this, like the scale, they're different. And here you see that the risks are really, really higher here. So what is it that we do to ensure that, well, that the policies that they follow that evidence? What is it that we do to support that? And here I will put the links to these publications in the chat. A great collaboration again with IARC, where we have put that evidence together and also explain what could be done in terms of better prevention, again, taxation, very important, but also behavior targeted interventions. I think it's very important that, again, that the role of health professionals is really crucial, that health professionals know the risks and then they educate their patients. And I think, again, youth ambassadors can play a really, really great role in that. And one area that I want to highlight at the end is labeling, because it's really important that that whenever consumers are buying a product, that they are adequately informed about what is it that they're actually buying and the health risks related to the product. And this is something that we did in 2018. It's a systematic review of all the labeling provisions in the WHO European region. It's so we looked at different things, also things like ingredients, and then like things like nutritional value, calories. Those things are displayed on bottles of alcoholic beverages, as well as any health information messages, including cancer, for instance. And we found out that, it's actually very, sad. What is it that we have, or rather don't have, in the European region? Because until today, alcohol, it has escaped labeling provisions of both of food regulation and also regulation of psychoactive substances. So in a way, we have a situation right now in our region, that whenever I go to the supermarket and I buy, I don't know, let's say a carton of milk, I will receive more information on, what the ingredients are, what, the calories are and so forth on a carton of milk as, I don't know, any alcoholic beverage that I buy. I mean, in the region overall, there are of course differences. And if I, for instance, buy some over-the-counter medicine, painkillers or something, I will receive much more health information for that than, like, again, buying an alcoholic beverage. And I think like this is absolutely unacceptable from a public health perspective. Again, bearing in mind that we're talking about an addictive substance, that we're talking about a substance that causes cancer, where the risk is, like starting basically from the first drink. And here just an example that unfortunately for now, Turkmenistan, it's a country in Central Asia, it has for now the best alcohol labeling provisions, because it is the only country that is saying really clearly in, like a really clear font, 20% of label size in national language, but also in English, that alcoholic beverages are harmful to your health. And also they have the ingredients listing. And for now, we don't have anything like that in any other regions. And yeah, if you have new information on that, please let me know. However, we have a great window of opportunity. It's really, really commendable, and I'm personally very excited about that the EU Beating Cancer plan, that it makes this strong commitment to develop something on labeling, because in relation to cancer, there is not a single country in the world that has cancer-specific health labels at the moment. I know it is in the Irish bill, which is not yet implemented. And then I think South Korea is another country that has suggested it, but it's not yet implemented. So, and the EU Beating Cancer plan, it makes this suggestion, I mean, not of cancer-specific things, but it makes a commitment to provide something in relation to ingredients listing and something in relation to health information. And I also have to emphasize that for now, the EU Beating Cancer plan, from what I know at least, this is the only EU document that commits to the 10% reduction target, which is really important. And I think if the EU Beating Cancer plan would introduce cancer-specific health labels, that would be such an important milestone, a historic milestone, not just for the EU, not even for the WHO European region, but really for the world, because it's really, really something that is long overdue and is really important. And with that, I would like to conclude my presentation. And if we have 2 minutes, I'd just like to show a film, which will be actually shown by Gina.
Yeah.
Thank you very much.
Thank you so much. I'll just show the video and then just conclude. Thank you.
While this is loading, I just want to say that this is something that was produced also as part of the launch of our labeling document of our report on labeling in the WHO European region.
Bear with me, sorry.
Да, конечно.
Yeah, I think so.
Je pense que oui, ça serait une très bonne idée et ça permettrait ainsi aux consommateurs de savoir qu'il y a des risques.
Ja, also ich denke generell, dass Warnhinweise oder auch einfach nur eine Aufklärung über die Inhaltsstoffe und die Gesundheitsrisiken, die damit zusammenhängen, auf jeden Fall auf jedes Lebensmittel und jedes Getränk gehören sollte.
Well, that is, I didn't know that, to be honest.
Я думаю, что это неправильно, она обязательно должна быть.
Если доказано, что способствует, если известно, что способствует, значит, об этом надо сообщать.
Bon, je pense que si on veut être cohérent, il faut en mettre aussi sur les boissons alcooliques, vu que de toute façon, il y en a déjà sur le tabac, donc je pense que oui, il faudrait le mettre.
Alkohol wird ja irgendwie auch immer ein bisschen unterschätzt so als Droge und ich glaube eigentlich genau deswegen ist es auch wichtig, dass wir das auch gerade auf alkoholische Getränke so einen Warnhinweis labeln.
I think it would be more credible if they did put on at least a little noting, just so you are aware this could cause this and this.
Here we go. Sorry, I hope that was fine and everyone could hear the video, and thanks for sharing. And that's also been tweeted, of course, from the accounts of the WHO, and all the resources that Maria mentioned will be shared with you, maybe later in the chat, but also in the follow-up email. And I just wanted to thank her so much for complementing nicely, actually, the previous presentation from Dr. Soerjomataram, and really flagging that policy responses and awareness of these major risk factors are still very much, unfortunately, pretty low. And Europe is lagging behind. That's what I learned. And I also learned that Turkmenistan is leading the way on alcohol labeling. So, you know, with the Europe's Beating Cancer plan, I'm really hoping that we really urgently need to translate this evidence that, as you said, you know, it's been there for over 30 years into comprehensive strategies. We have the pricing, we have the labeling. What about something a bit more comprehensive? And indeed, we are all very excited about Europe's Beating Cancer plan and the recent publishment of the roadmap. So cancer leagues and civil society, we are definitely going to ensure that this proposal for the mandatory labeling will be done, will stay on the program and will not be forgotten. So now I will hand over to David and we can have maybe 5 minutes for questions.
Okay, thank you, Gina. I'll try. I think this is a topic that could have 5 hours of discussion, maybe. But the first question is an open one. About, is there a consultation coming up on the EU's in the cancer plan or something around the labeling of alcohol products? Just to say what I'm aware of, of course, I don't speak for them, but in the roadmap they released last week, the European Commission, they say a proposal for the mandatory labeling and impact assessment will be in 2022. So surely there should be some kind of consultation. I don't know if you know more about these efforts, Maria.
No, I mean, same as you, I just know that the roadmap was published there. I forgot to say that. It's very important. Yeah, but I know that there is, some work happening in the background. So hopefully we will see a good proposal in line with the activities mapped out in the roadmap for that.
Great. And then the question about the engagement with industry. What's the WHO's approach to this in regards to both the producers and maybe also the retailers? And how has this worked or not worked from your perspective?
Well, I mean, as you know, it's very clearly regulated for us. We have the FANSA mechanism that really maps out like what is it that we can do or cannot do. And there are meetings happening with the industry, I think twice a year, organized by our colleagues in HQ, whereas, you know, like there is a dedicated space and time to exchange. And well, my personal opinion, it's very important that the industry is also sharing data with us, because I think it's for, if there is sort of an area of mutual understanding, then it's really important to understand what is happening specifically, and also in relation to unrecorded alcohol. And there was already a comment in the chat that I want also to tackle here, namely, there are a lot of arguments, or let's say like, we hear it quite a lot, that if you increase taxes, that then, you know, like illicit trade, unrecorded alcohol, that it will increase. And please, if you have any evidence on that, please get in touch with me, send me, you know, like send me the stuff that you have. I'm really, really interested in that, because we just did a very comprehensive global review in different languages. And so far we didn't see that. So if, you know, there is a really good documented case, and I mean documented by where we have the evidence, because we will follow the evidence, you know, like it's not that we're ideological or something here, we follow the evidence. Then we will, you know, pick it up and analyze it and present the results. But so far, in all the, and for instance, Russia is a great example, where really high increases in taxes were implemented, and also in combination with minimum pricing. And we didn't see, you know, an increase in unrecorded alcohol. And also maybe just to tackle that one question back to taxation, I think it's very important and very crucial to look at the tax structures, because tax can be effective only if you have, you know, like the needed level of it and also the needed structure, because there are different ways of how to tax alcohol. And I think for now, the evidence points that the most successful mode of taxation is specific taxation, where you actually tax the alcohol, the ethanol content as the main vector of harm, the stuff that kills people. But at the same time, keeping in mind that things like spirits, they're super easy, super cheap to produce. I mean, at least, you know, in certain countries like vodka, for instance, it's just based on ethanol and water. And then what we have learned from Russia is that if you have specific taxation or a tier system or whatever, and then you have minimum prices, then you reduce the affordability of the cheapest products. And I think there are a lot of very interesting examples, again, coming from the eastern part of the region, where we can really learn that, not as based on modeling, but as based on real life things that actually happened and that have actually led to a reduction in mortality and in consumption, and where actually the government has also increased revenues through that. Thank you.
Excellent, thank you, Maria. I think that's the 5 minutes gone, Gina. So All right.
Yeah, sure. Actually, yeah, we're slightly running out of time, but we hope you can stay with us slightly more because we wanted to launch a quick poll just to, let's say, test memory and knowledge of what's been done. And I'm going to launch it now. So you will soon start receiving a pop-up window on your screen. And you can kind of engage in the quiz if you like, of course. And our Youth Ambassador Nena is going to go through the questions. And then we just do some very short concluding remarks. And then we can go ahead with our Fridays. So I'm launching the poll now. Here we go. So it should quickly come up on your screen, and you can kind of, it's based on the presentations that were given today. So we kind of, want to try and make it a bit more interactive, because unfortunately we had to set this up as a view-only webinar for the time constraints. But we would like to hear, if you listen to the presentations and what you've learned. And now to Nena. Thank you.
Yes, and as a reminder to those of you watching this recording online, you can still mentally participate. So I'm going to read the questions out in case you want to test your knowledge. So question 1, alcohol has received by the International Agency for Research on Cancer what type of classification compared to tobacco? Question number 2 is a true or false question. Half of all alcohol-attributable cancers are not due to heavy drinking. True or false? Question 3, which country has cancer-specific health information messages on alcoholic beverages or advertisements? Question number 4, drinking alcohol increases the risk of how many types of cancer? Question number 5, true or false question, the majority of alcohol-attributable cancers are diagnosed in women. True or false? And finally, in 2020, how many alcohol-attributable cancers were diagnosed in the United Kingdom? So try your best and test your knowledge.
Thanks, Nena. So we're getting some responses in. I'll just leave it open for another couple of minutes for those of you who want to give it a try. And of course, we will share the correct responses after you with the webinar. And in the meantime, maybe I'll just hand over to David for some concluding remarks and key takeaways from today. But you guys can, of course, keep participating in the poll.
Great. Thank you, Gina. Thank you to all the speakers, to Isabelle. Once again, another fantastic presentation. Also to Maria, really great, really appreciate that new information, lots of new information for me about the excellent work that's ongoing with WHO, and great to see the collaborations between WHO and IARC in this area to give us a lot of relevant, up-to-date materials and intelligence. This is really appreciated for us today. A special thanks as well to Nena for being our Youth Ambassador, for joining us and helping with the preparations and great questions. We appreciate that. And of course, to my colleagues, Gina and Anna and the team for the smooth functioning. So thank you. And of course, thank you for everyone to join today. And just to say that we didn't have let's say, an exclusion criteria for the attendance and participation today in the webinar, because we're talking about the science from the perspective of the European Code Against Cancer and the measures taken from the WHO Europe recently. And we think it's important that everyone hears that. Of course, in the chat, you're free to engage in the dialogue with that, but we consciously wanted to keep this open to everyone because we want to communicate what we know and learning about this important topic. And to come back to the purpose of this webinar series, we're talking about the messages of the European Code Against Cancer, which of course is cancer prevention, cancer risk reduction specific, and has substantial and I'd say excellent evidence that's underpinning it and which is improving all the time. And we hit a reminder, of course, about the European Code Against Cancer's the message about not drinking alcohol being better on balance for cancer prevention. And this is an important point for us to bear in mind. And I'm just happy that Nena reiterated that, because we also have to consider the wider context too, as we've had some in discussion from the questions, but also from Maria's really nice intervention about this current policy initiative, Europe's Beating Cancer Plan. And just saying the concluding words that our contribution to the development of Europe's Beating Cancer Plan, we had a section on that, which we talked about Europe's drinking problem, because as you saw from the slides that Isabelle showed earlier on, the largest consumption of alcohol here in its global perspective is here in Europe. And we've seen also the evidence that's emerged, the contribution that alcohol has to the cancer burden overall. So it's clear that there's something that needs to be done about this situation from a public health point of view. Of course, it's a difficult question, and difficult questions don't have simple solutions. And if anything, although this is a simple statement, it's not easy to implement in practice, but if anything, we need the comprehensive, complex, interconnected series of measures around certain areas such as the pricing, the taxation, the marketing, advertising, labeling, the availability and accessibility of these products, and then also, of course, the wider social norms around the culture of alcohol consumption, which requires itself some basic information and the awareness and knowledge about the contribution of alcohol to the cancer burden. And we've seen that especially in Isabelle's presentation. But we know for sure from extensive work that's been done in different countries in Europe and beyond, that the awareness and the understanding of the contribution of alcohol consumption to cancer risk is pretty low. So that is certainly a starting point, and that's what we've been working on with this iteration of the code the last couple of years, is to communicate not just to people and not to lecture people, of course not, but to communicate to also the medical community and to decision makers, policymakers about this fact, because this would really help improve the situation that we see in Europe around the contribution that alcohol is having to not just complex non-communicable disease such as alcohol, but there's also wider societal issues that are tied into it too. And so taking these together in the round, increasing the awareness, knowledge, and specific in relation to the contribution of alcohol to cancer is one step forward, but really we're thinking about this to change the culture and social norm gradually, respectfully over time. And that will be, a long-term effort that requires a lot of discussion, debate to find the right mechanisms to do that. But we have to make the effort. We have to try to improve the situation, because we can see clearly in the evidence that there is a significant public health problem here, and more specifically for what concerns our topic in the world of cancer control, the contribution of alcohol consumption is clear and unambiguous. So we need these complex, interconnected population-wide measures, but we also need a calm and grown-up and informed discussion to hopefully change the culture to one where we can make it that Europe no longer has this drinking problem. So that's the culture, the context in which we would like to have had the discussion today. And I'm really happy that we had a good attendance and people to join and actively participate in the chat. I know not everyone is going to agree, but what I hope everybody will agree is that alcohol really is a significant issue for cancer risk, and we're committed to doing something about that with this small effort here, but of course going into the future we will continue that, and we hope to see Europe's Beating Cancer Plan contribute substantially to that effort. So thank you everyone. As was said, the slides and the recording are going to be shared afterwards. If we couldn't get to some specific questions, we'll try to answer them together with the speakers in the follow-up. Next year there will be more webinars about the specific messages of the European Code Against Cancer, so we'll be announcing them in due course. But thanks again for your time today on Friday afternoon. We really appreciate it, and special thanks to our two fantastic speakers, and have a good weekend. Goodbye.
Thank you so much, everyone.
Thank you.
Thank you.
Bye.
Bye.